We're here to provide an important update regarding the remainder of our school calendar. On March the 19th, I signed a state of emergency and joined these two leaders to announce that due to the COVID-19 pandemic, we would be suspending school until April 6th. Folks, we had hoped at that time that we were taking these cautious steps and would be able to welcome our students back into the classroom. However, the virus continues to spread. Today, I have signed a supplemental state of emergency that would allow Dr. Mackey and his team to provide instruction from home starting April 6th for the remainder of the school year. Now, this decision has not been made lightly. It's been made with a tremendous amount of concern and discussion. I cannot stress to our viewers enough, we must be serious about eliminating the spread of this virus. The public health orders are not suggestions. They have been put in place to save your life. Folks, this is for real. This is a deadly situation, and your attention is important to pay attention. And the stay-at-home, if possible, directive will be the only way we can mitigate the spread of this virus. This does not mean you stay at home and then invite all your friends to come over for a visit. Stay at home means to limit interaction as much as you can with other people. And nothing can replace the interaction between the teacher and the students in the classroom setting. However, access to high-quality instruction is crucial for our students to maintain a competitive edge academically. Certainly, we will be dealing with the fallout from COVID-19 in our health and economy, but the one thing we want to prevent from happening is a tremendous slide in our students' learning and student achievement. Students who do not have quality enrichment in summer lose proficiency. We recognize this would be the same situation but compounded if we did not find a way to be flexible with our classroom instruction. So we're doing the very best we can with what we have to deal with. We are also doing everything possible to ensure those with special needs who have an IEP 5.0 plan receive accommodations, and that these accommodations most closely approximate the therapy and special services they receive in a normal school day. We're doing the best we can with the things we have to maintain the delivery of high-quality instruction through alternative methods. And all of this will be done with a focus on equity to ensure that we are calling upon every resource to close the gaps that we can for each student. I believe that today's announcement, more than ever, echoes the motto of Dr. Mackey: every child, every chance, every day. Now I'd like to call on Dr. Mackey for remarks.
Thank you, Governor Ivey, for doing this today. And I want to say, especially to all of our parents and students out there, we appreciate your being patient with us over the last several days. And as we go through this unprecedented closure of a school year, many times I've already said this health crisis we face is unprecedented in our time. We've never had to shut down so many schools for such a long period of time. And yet Governor Ivey's leadership has been stable and strong, and she has made it clear that the health and safety of our students are paramount and they must be our first priority. And her order today makes that continue to be the first priority. And as the governor has said, we certainly are concerned about that long summer slide that may ensue. We are concerned about the lack of internet in some homes, and we're concerned about all the things that our parents and teachers and administrators across the state have brought to our attention, and they are concerned about. But what I want to assure our parents and students, teachers out there, is that we are working diligently with our local superintendents and their teams to make sure there is a plan in place for every school, for every child to continue their learning, to close out their school year, to graduate our seniors on time or very close to on time, And by the end of this summer, they will be moving on either into that next grade or moving on to their next step after high school. So I appreciate your diligence. I appreciate the patience out there of all the people in our state as we deal with this unprecedented public health crisis and the school's response to it. But most of all, I appreciate the strong leadership of our governor, who has continued to make sure that we know that her top priority is the health and safety of our students, their families, our teachers and staff, and all the people across the great state of Alabama. So, Governor, I thank you very much for that leadership. And I think Dr. Harris now has some comments.
Sure. Dr. Harris, our state's Director of Public Health.
Thank you, Governor. Thank you very much. I wanted to give just a brief update, and I know we'll answer some questions that were submitted in a few minutes. Just to update you so far, at this moment, we're just past 500 laboratory confirmed cases of COVID-19 in the state. The median age of people infected is about age 47. Around 3/4 of those are actually people between the age of 19 and 64. So it appears to be affecting people of many different age ranges. I want to just say thanks to Governor Ivey for her response on this, and just echo what she said to you a few minutes ago. This is really a serious illness. We really plead with Alabamians to take this serious, to understand the importance of social distancing, to understand that staying at home can really save lives of you and your family members and the ones that you care about. We were really sad to report the first death last night of a person who died who tested positive for COVID-19. We have other deaths reported to us that we're investigating now, and we'll release that information when it's available. It takes a little bit of time in public health for us to confirm exactly why a death occurred, and we want to be accurate and make sure that we understand exactly what has occurred. And so sometimes those reports come out a little more slowly than we would like, but we'll keep you updated on this as we get more information. We expect to see cases increase again for some time. We just plead with you to please take seriously these social distancing measures, please practice hygiene, and please try to protect those who are most vulnerable. Thank you.
And as Dr. Harris mentioned, we have some questions that have come through from reporters, and the first one we'll give to Governor Ivey. This is from Mary Sell with Alabama Daily News. She says, some educators and lawmakers have said there is an equity issue for broadband access, and students without it are at a tremendous disadvantage. What is your message to them?
We're doing all we can to close those gaps, and we certainly recognize there has to be an alternative method of getting instructional materials to those students that do not have broadband access, and that is being arranged with your superintendents getting to the students daily what we call correspondence packages, coursework for them to do at home. It's so important for our students to stay attuned and stay involved during the summer. We cannot allow them to have a summer slide in their learning achievement, and so we need to keep pressing forward. So that help will be forthcoming.
And Governor, we're going to continue on with a couple more questions for you. The next one is from Rashad Hudson with CBS 42 and Next Star Media. He asks, is this enough time for schools to begin implementing a new plan?
Well, we're giving multiple options for our superintendents that allow them to meet the needs of their own students. It helps meet the basic requirements of rigor and have adequate resources as well. This is the most flexible course of action that we can provide. It provides several options based on local circumstances, and we know our superintendents are working hard to provide the students with the learning materials that they need.
And Governor, from Kim Chandler with the Associated Press, as cases continue to rise, are you considering a shelter-in-place order as 21 states have done?
Well, I will continue to work with Dr. Harris and other medical experts to determine the best course for Alabama. But we are not Louisiana, we are not New York State, we are not California, and right now is not the time to order people to shelter in place. We've got to have our businesses operating to provide the materials that our teachers need, that our medical professionals need. We've got to have food provided, and we've got to have all the materials that are needed to keep Alabamians working as much as we can. But I urge Alabamians to heed the warnings. Social distancing is a must. Hand washing is essential. So folks, please do your part and social distance, and be sure that you're practicing good, clean hygiene.
All right, and Governor, one more for you. This is from Trish Crane with AL.com. For districts and schools that have no distance learning capabilities, how is the Alabama State Department of Education going to help them, and or what is expected of them?
Well, for sure, learning must continue, but health and safety are important, and I'm going to turn to Dr. Mackey to give specifics on what the State Department of Education is going to do to help these students. Dr. Mackey.
Thank you, Governor. I'm glad to address that question. We certainly do have different levels of capacity all across the state. We have school districts that have essentially one-to-one computer capacity, and they have pretty good broadband access because of their geographic location in the state. And we have other places where we have almost no broadband connectivity, and obviously lots of differences in between. As the Governor mentioned before, one of the things we're going to be able to offer is distance learning through online learning and digital platforms, but we're also going to be able to offer take-home packets as teachers, just old-fashioned. They make copies and they send things home. We have so many other resources across the state. The Alabama Public Library System has enhanced its hours for the homework hotline, so people who are working through their packet and they get questions and they get stumped on answers, they can call the homework hotline. There are over 3,000 people manning the homework hotline ready to help students and parents with those questions. Alabama Public TV has stepped up, and they're going to be broadcasting courses at different times during the day to different age levels and subjects, and so we'll have their delivery mechanism, which can get into many more homes than just internet. So we have lots of options out there. Tomorrow morning we'll be working with the superintendents in a general meeting, and then we'll be following up next week with each and every superintendent to help them develop the most meticulous and best designed plan for their individual community.
Dr. Mackey, I'm going to keep you up here for just a minute. We've got a few more questions for you. This is from Jerome Jones with Alabama News Network. He asks, how will students make up time lost so far during the school year?
Sure. So we're very fortunate that as many awful things as are happening because of the spread of this disease, this school closure came during a time when most of our schools, and indeed all of our schools, have one of these weeks as their spring break time. So even though school has been closed for 2.5 weeks, most of our students have only lost about 7 days of instructional time thus far, and we'll make that time up. We've had natural disasters before when students were out of school for 3 or 4 or 5 days because of snow, certainly because of tornadoes, hurricanes, and other disasters. So we know how to compress things, put some things aside, and focus on the most basic and essential critical learning standards. And we've identified, actually, for the superintendents and the information they'll get tomorrow, the critical learning standards, the most important things in reading and math for those lower grades, and then for the higher grades, all those credit-bearing courses. So we'll continue to work with them and make sure that we meet every need.
Okay, and another one for you. This is from Brad Gunther with WPMI in Mobile. What does this order mean for spring extracurricular activities? So sports, band, commencement ceremonies, etc.
Well, I certainly knew that question would have to be coming. So unfortunately for sports, for band, for those things, it means the end for this school year. We will be, in the next guidance that comes out to superintendents this evening, we'll be declaring the end of this school year as June 5th. Now, most of our schools would naturally be finishing up around May 15th. We've given them just a few more days, so if they need more time to, again, as we just said a few minutes ago, to make up for some learning loss, to make sure that students have opportunity to get in the work that they need to get in, they'll have a little more time. Many of them may finish before June 5th, but we want all the schools to wrap up this school year by June 5th. That essentially means that unfortunately, soccer, baseball, softball, track, band, all those spring activities are coming to an end, and they won't be able to complete those seasons. There are other activities, graduation ceremonies, proms, and the like, that we hope can be done. They won't be done between now and June 5th, but we certainly hope that many of our schools will be able to come back as the curve flattens and as the public health orders are changed, that they'd be able to come back and have those ceremonies maybe later this summer. We'll just have to see how that happens. And I'm truly I'm sorry, and I know the governor's sorry, and I know Dr. Harris is, that students are losing so many of the fun activities of their senior year that they really count on, but we just have to do what is the most important and pressing thing, and that's protecting the health and safety of our community.
And Dr. Mackey, this is a question from Brian Pia with ABC 3340. How is the Alabama Literacy Act impacted by the disruption of the COVID-19 outbreak? And how will this impact students next year when this is implemented?
Good. Let me say first on the Literacy Act. So the Literacy Act includes a provision that goes in place about 3 years from now where we will look at third graders, and if they're not on grade level, they'll be retained or they'll go to summer school or have some kind of makeup to get them on grade level. That is far enough off that we don't believe there'll be any impact on that provision. The big impact right now is that we're having to put assessment off. As everybody knows, President Trump gave a national waiver and order to put off state assessments for this year. And so we won't have those assessments to make instructional determinations this fall, but that'll be okay. We will come back and roll out our new state assessment next spring. We've already begun working on how we'll stay on track with the implementation of the Literacy Act. The only way we will get a little bit behind is that we've got a lot of teachers that are planning on the high-quality professional development this summer, and we've got to roll that professional development out. And obviously this will change some of their plans, but many of them have contacted us and said they are still ready to go. They want to move forward. They want to jump on professional development as quickly as they can because we've got such dedicated K-3 teachers out there. So we might get a little bit behind, but we will catch that time up very soon as far as implementation. And then the second part of that question was about this fall. So the most important thing that we will have to do when school starts back for K-3 students this fall is assess their learning and immediately begin addressing, as the governor said, any summer slide or any deficiency in standards. As much as we know that teachers are going to be working very hard over the next 8 weeks to catch students up and to get this year complete, we know that the time between when they last saw a classroom teacher this year and when they're going to see one in the fall is going to be greater than it's normally been. And as the governor said just earlier, there is nothing that we can do that can replace the impact of a teacher and a child working together on learning. So we will assess those students. Very fortunately, the governor led the way this last year to make sure, and the legislature supported her and passed a provision in the budget that allowed us to purchase at the state level for the first time ever high-quality early childhood screeners and assessments for math and reading. We will have all of those in place despite what's going on now when school starts first day next fall. And so, Governor, thank you for leading the way to make sure we had those assessments in place. We will roll them out, and in the first days of school we'll be assessing students, and our teachers will be addressing any learning deficiencies.
All right, and Dr. Harris, I think we're going to move on to a couple questions for you. Here's a few from Andrew James with Alabama News Network. What is the age range for confirmed cases? What is the average age of confirmed COVID-19 patients? And how is the state prepared for the surge of patients?
Sure. I believe I mentioned earlier that the median age for patients who are infected is age 47. The range actually extends from less than 1 year of age up to 97 years of age, so it's quite a spread. At the moment, about 8% of our cases we know about have been hospitalized. But of those 8% that are hospitalized, about half are in the ICU, and a full third of them are on ventilators. So we're working hard to make sure that we We have all the numbers. We know that there are reports from other hospitals that we're still trying to confirm. We have had a group working on hospital surge for some time, and it's a group of folks from hospitals, from public health, from the emergency management agency. They are making plans and running scenarios, trying to calculate exactly what the state would need based on what we've seen in other parts of the country. And we have good strategies and are starting to finally get those implemented. I know that there are a couple of larger cities in the state already that have very concretely laid out plans for where patients could go and how those facilities could be staffed and have medical supplies at those facilities. So we continue to be prepared for that to the best of our ability. We don't know what the epidemic will actually look like in Alabama, but we certainly have seen what's happened in other parts of the country, and we're doing our best to make sure we're prepared.
Unprecedented times right now. Alabama Governor Ivey ordering at-home instruction starting April 6. As expected, Alabama schools will not be back in session as hoped by next month.